Good morning. My name's Tyler Norris, and I am the CEO of Wellbeing Trust. We're the nation's leading philanthropy focused on advancing the mental, social, and spiritual health of the country. And I stand before you as a leader in the field, but it wasn't always that way. When I was 14, struggling with mental health and addiction issues, I found myself face-to-face with the criminal justice system. And instead of being folded into the system, community saved my life. I was diverted. I was given an opportunity for reconciliation and restitution. And I was folded back into the community where I could heal. And for the 40 years since, I've dedicated my life to building communities that are gardens to grow people in. Now, that's meant working in hundreds of communities around the country, and it's meant working on partnerships to build the kind of systems and policy changes that can result in the health of populations. Recently, my daughter, who's very sharp and is kind of all over these kinds of issues, said, "Dad, I've been looking at recent data that said after a century of increasing lifespans, in the last 2 years, Americans' lifespan has been shortening. After everything you've been doing, what have you been up to?" Yeah, it's kind of funny and really scary. Because on our watch, despite all the technology, the trillions of dollars that are being spent, we're going the wrong direction, mostly driven by the deaths of despair. When our foundation was launched 3.5 years ago, the first thing I did was we partnered with the Robert Wood Johnson Foundation and Trust for America's Health to look at the work of Angus Deaton and Jean Case on what is going on underneath deaths by alcohol, opioids, and suicide. Suicide rates that are tripling for young women at ages 11 to 14, and white guys my age, the tripling rates. Everything else doubling rates in the last decade and slated to double again. And what we needed to do was unpack that and go, what is underneath that? The hopelessness, the loneliness, the isolation, the lack of belonging. What is going on such that that is how we're dying? So that we can get at the actual root causes. I won't spend a lot of time on this side because you just talked about this. 39% of admissions comorbid, right? And I'm just going to say that I don't even think it's 1 in 4, 1 in 5. I think that's useful language at one level. It's every single one of us is either directly struggling with a mental health or addiction issue or somebody we love is. Every single one of us. So when we're looking at this, we're asking the question, well, what is it going to take not to just save a life or two, as important as that might be, but how do we turn the tide on the deaths of despair? What kind of a response is needed from our nation and from the trillions that we're spending to actually have a population-level outcome that my daughter would look at and say, now you're talking, Dad, instead of messing around. You're doing good things, but are you accountable for outcomes, right? That's the question. So we have to say, the loneliness, the isolation, yes, but what about the fragmented delivery system where only 1 in 10 people actually gets the substance misuse care that they're actually needed, and most visits don't integrate mental and behavioral health with physical. And then the conditions in communities that were discussed earlier, where racism and lack of access to living wage jobs and housing and food insecurity are all conspiring. So how do you really take this? Now, one of the interesting pieces around adverse child events, which is talking about our adverse community experience, the parabases, is that when you think about this, particularly this intersection between mental health and physical activity, most of the things that all of us do to deal with the trauma and the early life things we're facing, those are our attempted solutions that are driving our poor health outcomes. Look at Dr. Folletti's point, that most of the problems we're facing are our solutions to deal with what we are facing, shrouded by shame and secrecy, etc. So, for example, making the link with physical activity, let's get into nature. We found that when you, in fact, are in nature and physically active, that prosocial behavior, a sense of belonging, awe, and wonder, a sense of things that are actually improving our mental health actually improve. When I was at Kaiser Permanente, and there's some colleagues of mine in the room here from KP, we focused on walking. Why? Because physical activity particularly if you're doing it with another person or in nature, is good for your mental, emotional health. Being in nature, conviviality, human connection, that adds up. But it wasn't just enough to have the behavior change of walking. We need to create safe spaces. So we partnered with Girl Trek. Now over 1 million black women and girls walking, not just getting their physical activity, empowerment, belonging, leadership, taking back their communities. Vision Zero, making it safer to design communities where walking and biking is easier and safer. Complete Streets, making streets that routinely accommodate physical activity so that more people can be physically active and has mental health benefits. But if you really look at what's underneath this, what is this mix of forces behind the deaths of despair? It isn't going to just take clinical changes and changes in our policies and practices and building partnerships. It's going to take a new way of thinking and a new way of acting about mental health. So our foundation is the leading philanthropy right now, bringing policy leaders together, bringing philanthropy together, is committed to saving 100,000 lives over the next decade through a social movement approach. So what we're looking at right now, and you're welcome to see this, I'm adding it so you can look at it later if you wish, is a framework for excellence that is capable of a population-level outcome on mental health rooted in changing community conditions, assuring everyone has coverage for accessing services, and that there is no wrong door, whether that's the health system, one's school, one's workplace, or the criminal justice system. The largest provider of mental health services in the state of California is the LA County Jail, right? So let's think about where the actions are. Our priorities are 3. Get the care right, get it paid for, and create the conditions for mental health and well-being in the first place. And great care, as was talked about, is not only integrating physical and behavioral health, it's integrating social needs. If you don't ask about food insecurity and housing insecurity or domestic violence and address that, you're not going to actually change someone's behavior. It's not going to work. It doesn't work. You have to integrate physical, behavioral health, and social needs. That's quality. Anything short of that doesn't add up. Secondly, we need to drive federal policy to pay for it and create these gardens to grow people in. So we're committed right now to a social movement, new narratives that make it safe and reasonable to talk about our mental health issues. Pull the stigma out, normalize the conversation. It's all of us. We share in our suffering, whether it's our own or each other. Secondly, metrics and data systems, like we've done with WIN measures, winmeasures.org, new measures that are being adopted in this country through the National Committee on Vital Health Statistics, looking at a well-being adjusted life year, not just a disability adjusted life year. What does it mean to live healthier lungs? Standards of care excellence that I'm saying, that says standard quality care, behavioral health, physical health, and social needs, warm handoff referrals, right? If you know that your current model of care isn't adding up to population-level outcomes, it is unethical to continue behaving that way. Policy and advocacy. Good federal policy, good state policy, and advocacy organizations to drive it. Bringing more money into the field. Only 3% of philanthropy is dedicated to mental health, and yet it's killing 170,000 of us a year. So last week, we released federal policy on Capitol Hill under Healing the Nation on what federal policy needs to look like for integrated whole person care with no wrong door. We are partnering with dozens of NGOs across the country on transportation, on housing, on early childhood development, first 1,000 days, living wage jobs, because we know that communities are what gives rise to mental health in the first place. And what we're seeing right now, which is so exciting, is that it is not just all the apps and technologies and new forms of care that are important. Those are vital. But it is the way this nation is beginning to rise to say that we cannot go on the way we have. We are in this together, and our nation depends on our mental health and well-being. There is no health without mental health. Thank you.